Good morning. The House Health Policy Committee will come to order. Will the clerk please take the roll?
Chair Collins.
Here.
Representatives Merriman. Whiteford.
Here.
Alexander. Present. Eller. Here. Cow. Filler. Mueller. Keeler.
Here.
Fink.
Here.
Roth.
Here.
Tisdale.
Here.
Whitworth. Here. Cummings. Here. Kohetsky. Here. Stone. Here. Whitsett. Here. Neely. Morris. Here. Madam Chair, you have 14 members present. You do have a quorum.
Thank you, Madam Clerk. Representative Whiteford moves to adopt the minutes from our meeting on May 13th, and without objection, the minutes are adopted. On our agenda today, we will hear testimony on House Bills 4521 and 4762, and we also have a special presentation on EMS provider issues. It is National Emergency Medical Services Week, and we do want to take a moment and recognize all of the dedicated EMS workers in our state who are constantly on call to help in a moment's notice. They work every day to safeguard the health and the safety and the well-being of our communities, and we are very grateful and appreciative of their work. Even during this past 14 months and the pandemic, EMS workers have continued to risk their lives to save the lives of others. Today we have some amazing EMS workers with us to present on some of the issues they're facing as providers. So I would welcome to come forward to share your presentation, Ken Cummings. He's the president and CEO of Tri-Hospital EMS. Also joining him is Denise Pope, paramedic with Southwestern Michigan Community Ambulance Service. Ron Slagel, president and CEO of Emergent Health Partners, and Jeff White, chief of Richmond Lennox EMS. Welcome very much, and we look forward to hearing your presentation and better understanding the challenges that you face as you work every day to keep us safe.
Good morning, and thank you for having us here during EMS Week. My colleagues and I are here today during this important week in our industry to highlight the reality of the challenges EMS is facing right now. We are all members of the Michigan Association of Ambulance Services, which represents 70% of Michigan's counties. In 2020, MAS members were responsible for more than 60% of all ambulance transports in the state of Michigan. EMS always stands ready to provide life-saving medical service to our citizens. Our paramedics and EMTs represent the tip of the spear as it relates to emergent health care. Our teams, as the chairwoman mentioned, have been on the front lines of this pandemic and have put their own health and that of their very families at risk of taking this disease home for the past 14 months. Through this time, there's been a continuing reality for our industry. The reality is we've never been properly reimbursed by our state, those who thank us regularly, for our work as it relates to the service to our Medicaid patients. We're now working on this with your colleagues who sit in the DHHS budget committees. Due to these funding and other regulatory issues, EMS in this state, I fear to say here during EMS Week, is near to collapse. Today, as we sit in this hearing room, EMS agencies throughout Michigan are unable to find enough paramedics to serve your communities. This has resulted in working our local heroes to the point of exhaustion, and in some cases, being unable to staff the number of ambulances needed to properly serve your cities, townships, and villages. As agencies, our mistake before today had been to just deal with it. Frankly, it's our nature to work in crisis. It's our fiber to triage disasters and to find a way to fix problems. It's not within our comfort zone to create them or be the persons asking for help. I've now been doing EMS over 30 years. It's all I've ever known. And as I sit here today, I share with you this painful reality. The safety net which provides you and your families that we afford is near collapse. For us to survive, something must change. But importantly, and what I hope you'll keep in mind as we go forward, it must change quickly. We would call this a priority one, or an emergency response. As I conclude my remarks, I want you to know your recognition is genuinely appreciated. But EMS is bleeding, and we need your help now. And I'm going to allow my colleagues to expand a little further on my introduction. Thank you again very much.
Good morning, Representatives. My name is Ken Cummings. I am the President and CEO of Tri-Hospital EMS from beautiful St. Clair County, home of Representative Andrew Beeler. It is a privilege to be here today, and thank you for the opportunity to share our issues with you this morning. Today I'm here to speak with you about a growing problem within the ambulance industry here in Michigan. The challenges our industry faces today is a statewide problem, and it impacts every type of ambulance service operation in Michigan. This is not a Democratic or Republican issue. This is a Michigan issue. For the past 3 to 5 years, our industry has been experiencing a significant decline in the availability of EMTs and paramedics. Organizations like mine have found that the number of new applicants seeking careers in the ambulance business has been steadily declining. The problem is becoming so bad that we are now starting to hear of ambulance services across Michigan that are being forced to reduce coverage to their communities simply because they cannot find staff for their ambulances. Unfortunately, the solution is not simple or probably quick. It would be easy for me to sit here and tell you today that COVID is to blame for this problem. But the reality is that COVID simply brought the situation to the surface and to the forefront much quicker and really has exacerbated what has been an ongoing problem for the past 3 to 5 years. If you're wondering why you haven't heard much about this problem before, it is truly because many of us in the ambulance industry, as my colleague has just mentioned, have been our own worst enemies. We are, by the very nature of our training and what we do, crisis managers. When we are faced with a crisis situation, we jump into action to develop a solution and mitigate the crisis. No matter the crisis, we immediately assess the situation, develop a plan, and we act. But it's no longer possible to triage this crisis on our own. Today, we are here to ask the Michigan legislature and the governor to increase funding for ambulance services. For too many years here in Michigan, ambulance services have been subsidizing the state's grossly inadequate Medicaid reimbursement for ambulance services on the backs of our employees through lower wages. The strategy has now come back to haunt us here in Michigan. Within our state alone, there is currently a need for more than 500 new paramedics. EMS agencies are like mine are forced to pay double time for overtime just to cover our shifts today. This method of overworking our employees, the method of overworking the employees we do have isn't sustainable, and it'll continue to lead people out of our industry. Ending the underfunding at least would help us adequately pay our staff and make this grueling job worthwhile. We urgently need to get new paramedics into the field, and that requires training yesterday. That's why the Michigan EMS is asking for a $5 million one-time tuition grant that would include our privately run proprietary school programs that are often excluded from state programs. Our teams have been on the forefront of this pandemic and are expected to be ready 24 hours a day, 7 days a week. Now we need help so we can continue to serve the communities properly. Thank you.
Good morning. My name is Ron Slagel. I'm the CEO of Emergent Health Partners. which operates 4 not-for-profit ambulance services across the I-94 corridor, including Huron Valley Ambulance, Jackson Community Ambulance, Monroe Community Ambulance, and Life Care Ambulance. At the age of 12, I knew I wanted to become a paramedic. My passion was to help people in their moment of need. I have worked my entire adult life in EMS. Now my job is to help lead my organization and to advocate help for our frontline paramedics and EMTs, our heroes on the front lines who care for the residents of our state when they call 911. Michigan EMS agencies are not being paid adequately for our work. It's as simple as that. On average, EMS providers are paid for 10 to 25% of our cost. That averages out to about $178 per transport. Our biggest payment issue is with Medicaid, and that's where you as legislators can have an impact. Michigan EMS agencies have not had a true increase in Medicaid reimbursement since the year 2000, and we have now been reduced twice since then. I have paramedics and EMTs working for me that were not even born yet when the EMS received its last increase from the state of Michigan. They deserve to be fairly compensated for their very hard work. Our agencies do the very best we can to be an integral part of our communities, and we have used many approaches uniquely to solve the problems that we encounter. Well, we have used all the tricks in our toolkit. We have none left. We are not magicians. The reality is this underfunding has to end. Expenses have been increasing much faster than revenues before the pandemic, and the significant added challenges of the pandemic have literally put EMS on life support. Last week, I waited 30 minutes in the checkout line at the grocery store. That was inconvenient. That would not be acceptable if that becomes commonplace to wait 30 minutes when someone dials 911 for their ambulance call. Thank you for recognizing our EMS professionals, like my colleague here to the right who will speak just after I do. They deserve that appreciation, and we truly appreciate that, but they don't get enough appreciation for what they do. But that's far from enough. We need tangible action, which only you as the elected officials of our state can do. I am pleading with you to do what is necessary and what is right to ensure EMS is readily available to respond when our services are needed. Thank you.
Hello. First of all, this is very much out of my element, so excuse me while I stumble through this. I'm going to do my best to represent all of my coworkers in EMS and my family in EMS. I want to put forth how exhausted we are. We have been underappreciated, underrepresented, and underrecognized since well before I was brought into the EMS world. It's normal for us to work 36-hour shifts up to 72 to 96 hours in a week. We see our stations more than we see our families. And it's not unusual for any of us that work on an ambulance to work more than one job just to make ends meet. It really does come down to we have to pay our own bills, and to do that in EMS, we don't see our own families. It's not uncommon for an EMT or a medic that you'll have answered that 911 call for yourself to have been on shift for 36 to 48 hours. And to make up for these staffing lacks that we have, because we don't have new medics and EMTs coming in. It's too easy for someone to go through school to be an RN versus be a paramedic and work on a truck where we don't know what we're walking into. We don't have a secure job, we don't have secure income. And at this point, we don't know if our service is gonna make it through the end of the year sometimes. We're losing our colleagues to nursing because there is no security in EMS. We aren't recognized as far as the first responders go. It's something we accepted when we came into EMS, and we take that on. We love our communities, and that's why we do what we do. But as my coworkers said and my colleagues said, we need help. We need recognition from a level higher than ourselves, that the reality is we're coming to the point that one day somebody might call 911, and whether it's you or your families, there might not be somebody to answer that call that day. And if things don't change and change quickly, that's a reality that we're all gonna have to face, because there are only so many of us out here, and we're stretched to our limits. And thank you all again for hearing from someone like myself that is not used to doing this, and I appreciate any help that you can give us and the recognition that you've given us today.